Hi, I'm Beth Cruiser, and I am a park ranger for Yellowstone National Park, and I work in the backcountry. And as a result of my job, I had a severe shoulder injury in 2013 that resulted in a complete rotator cuff repair, slap, and I actually ripped the bicep completely off the bone. I had surgery in Jackson Hole, Wyoming. I came back to Houston to begin my physical therapy, and I did that for about 5 to 6 months, but as that time was progressing, I was developing a lot of different symptoms in my shoulder and in my neck through this brachial thoracic region, where I was getting a lot of deadening sensation and a lot of sharp pain, a lot of pins and needles where I couldn't use my arm, and I was actually slowly losing the strength and the ability to use my arm. And as you can imagine, I was really frightened. I didn't understand what was going on. There was no explanation. I went through a lot of doctors. Eventually, it was diagnosed as thoracic outlet syndrome. Who's heard of that? I've never heard of that before. So it was something that was very scary for me, and I didn't understand what that meant. Finally, I found Dr. Peter Lynn with Baylor, Chief of Vascular Surgery, and I explained to him my symptoms, and we had many discussions about what I was experiencing, the severity of my symptoms, the severity of if I didn't get a surgical intervention, in the long run, how I could have a potential future long-term disability. It all sounded very scary to me and intimidating, and I just experienced a lot of discomfort. Dr. Lynn was extremely informative and very good about easing any of my concerns and fears about how this was going to be surgically handled. We finally went into surgery in August of 2014, which was a little over a year of my initial surgery for shoulder. And the surgery went very well, and I was in the hospital for 6 days. It was a long time because I had a lot of drainage, and we had to make sure that a lot of the blood and liquid and stuff got drained out of my chest and thoracic area. The surgery was great. I experienced very small amount of residual discomfort. When I was released from the hospital, Dr. Lynn was very involved in trying to explain to me what the next procedure was as far as getting strength and full recovery and the length of time that I needed to expect. My experience, I understand, was a little bit different because there was so much damage done to the shoulder and to the tissue and to the thoracic area. There was extensive scarring and stuff, and Dr. Lynn removed a rib, a scaling, and extensive lesions. So probably within 2 or 3 months after surgery, I began physical therapy. It was very intensive. It was, when I first went in there, I was really concerned whether I was ever going to resume a normal life again, whether I was ever going to resume my job, whether I was ever going to be able to golf again, or just feel like you want to get back and engage in life. And it's a very emotionally and difficult period because you are afraid, how am I going to go back to my normal life? And I had all those fears, certainly I did. But through physical therapy, which lasted I did 18 sessions, so a little over 2.5 months with Ironman Sports Medicine through the guidance of Dr. Lynn. I am now getting ready to be released to go back to full duty status as a park ranger in Yellowstone National Park. I never thought, really, when this whole process began, that I would ever be here resuming my life, and I am so thankful for what Dr. Lynn has done for me and given me the confidence and the way that he has taken care of me And for all the people out there that have any concerns about thoracic outlet syndrome and how it's going to affect your life, just be patient, have faith in the doctor, have faith in Dr. Lynn that he's going to guide you, because he truly will, and you will get better, you will get stronger, you will have your family life and your social life back, and just stay strong, and trust me, it's going to be worth it, and he will take you through the entire process. And I cannot be more thankful to Dr. Lynn, and God bless him. That's all I can say.